Good morning, Latoya.
Good morning. How are you?
I am doing well. How are you?
I'm wonderful.
So first of all, thank you for making time to talk with me this morning about this. We have a pretty diverse array of things to cover, and I'm very humbled, first of all. Let me start there.
Stop.
And Planned Parenthood, Illinois Action is humbled to be sitting with a really young and dynamic university leader who's Black. We don't get to have these conversations very often in spaces like this, looking like us. So very excited to be here and be doing this work. I'd love for you to just talk a little bit about what brought you to this organizing space and sort of where your interests fall within organizing towards sexual and reproductive health care.
Sure. So I am someone who really believes in education and helping the people who are coming behind me, have all the resources and the information they need to be successful. That's something that I've kind of been committed to all throughout my time in high school, college, law school, and post-grad. And so following with an organization like this whose pillars really are about education and making sure that everyone has the appropriate resources, access to resources that they need, really just aligns with all of my values. And so it just made sense for me to get involved and learn some things myself and then give back in ways that I can. So
absolutely. Thank you. I want to get right into the meat of the topic.
Okay.
So I love to start with the Title X program and Governor Pritzker. So Title X is the family planning program that exists across the U.S. And that a great deal of Black and brown people, particularly Black and brown pregnant people, use to access sexual and reproductive health care. And unfortunately, over the last several years, dealing with a president and an outgoing president and a Congress that have not exactly been champions of sexual and reproductive health care. They attached a gag rule to Title X, which means that if you wanted to use these funds towards family planning services, you could not talk about abortion or offer abortion. And luckily, Governor Pritzker rejected those funds and made sure that there wasn't a deficit in sort of the funding that goes towards comprehensive sexual and reproductive health care. So I'd love to hear your thoughts about Title X, and I think really just the implications that laws like that have when trying to sort of legislate how Black women and Black pregnant people get to determine their pregnancies and their lives.
Right. I think that access to healthcare and information is already so limited for so many people, right? It's really difficult to get genuine, honest, and informed information. And so I think a lot of people, even if they maybe aren't at a position where they're actually requesting an abortion or need one at the time, they want to get information, right? They want to know what's accessible to them. And so when you visit a doctor and, you're there just asking them questions or just trying to get genuine information, it's really disappointing that we are in a space now where they're trying to limit simple information that a healthcare provider in doing their job can offer to people, especially in a space where, it's really difficult to find that information. Obviously, we have access to the internet, but even that is limited sometimes. And then what are you finding on the internet, right? So you want to go to a trusted source. And so I think it's really detrimental to everyone involved to limit what they can say. I want to say I understand the difference between, actually offering services and maybe putting a gag on that, but simply offering information, it's really something that was shocking to me and really disappointing, especially considering, how hard it is to get that information for people. So I am grateful to our governor, for having the mindset and understanding of knowing that that wasn't something that we wanted in our state and, preventing that from hindering us.
Absolutely. And I think we've seen very quickly the adverse effects, as of summer 2020, there are 6 counties in Illinois, in central Illinois, that don't have health centers that offer contraceptive care because Planned Parenthood, for a lot of places, are the sole contraceptive care providers. 1 in 4 women in the state of Illinois get their contraceptive care from Planned Parenthood of Illinois. So we've seen a real shift in where those services are become available. available. And it's no coincidence to me that, this is happening at the same time where we see, heartbeat bans and like fetal heartbeat bans,
Right.
and, states like Georgia and Louisiana and Mississippi having one or no available clinics.
Right.
It is the wildest thing I've seen since starting this role,
Right.
but also just watching over the last maybe half decade, because like my entrance to politics was not a long time ago,
Right.
and seeing what became the foremost priorities of this administration, the post-Obama administration and Congress, it's very much, we're going to tell women they can do this, they can't have access to these things, and it's so
We just want to
draconian.
limit your body.
Exactly.
Right? It's not your body. We're not going to allow you to have the choice or
Yeah.
information that you need to help yourself. Right?
Exactly.
Yeah. So-
And it's such an ahistorical, politicized moment,
Right.
because, family planning has always existed.
Exactly.
Throughout the course of human history. Pregnant people have always planned their lives. So now the pseudoscience and the disinformation that's used to deter people from accessing healthcare that 1 in 3 people will need is absurd.
Right. Yeah.
And the Title 10 takes us right into the Hatchet Amendment, which is the Senate appropriations. It's not even a law. It's just a resolution that's been attached to the Senate appropriations bill that then Speaker Paul Ryan tried to make law, but
Right.
ultimately that did not happen, which stipulates that federal dollars cannot be used for abortion services, which is such this is blocked funding, I think, since 1976.
Right.
And what the Hatchet Amendment also dictates is that under extremely narrow circumstances can public dollars be used for abortions. But if the mother or the person who's pregnant is at risk, in most cases, they still won't be allowed to use those funds,
Right.
which is like, we have that happening, and then we don't understand the Black maternal mortality rate, and it's like, how are we not connecting these dots?
Right.
And the reality is, 30% of Black women and 20% of Hispanic women are currently enrolled in Medicaid, and 1 in 5 women who are enrolled in Medicaid are of reproductive age.
Right.
So it's like the layers and the circles of people and the less and less and less coverage that's actually available.
Right.
I'd love to hear any sort of thoughts you have about the Hatchet Amendment.
Sure. I just think it's really interesting that there are so many people in this country who rely on federal dollars for their health care, right? I mean, I think it's something like 15 million people who really need this funding, and now, if they needed that help, they simply just couldn't get it. And I don't know how, the government says that they represent all people, but then also disenfranchise millions of people at the same time. I think it's incredibly saddening. I also can't understand how it's been in effect for so long, right? After it's so many administrations, and we see, the mortality rate of women going up increasingly every single year.
Yep.
How is this not something that's being addressed, right? It's, I question it all the time.
Yeah.
I see it coming up more and more, and it's really something that we need addressed.
Yeah, I'm very also excited about the incoming administration.
Me too.
With this is like, I think, something that we're going to be addressing very aggressively within the first 100 days of the Biden-Harris administration, because now there's no reason that this should be on the next Senate appropriations bill on day one. That needs to be removed, because you both ran on these things. So now it's time to pay up. we would like all of our monies back for this program.
We are paying close attention.
Exactly.
Yes,
we are past listening and learning.
Right.
We need our money, and we need it now.
Absolutely.
So I'm very excited about them and their robust sexual and reproductive health care platform.
Yeah.
I'd like to move into the Reproductive Health Care Act.
Okay.
So this past year, Governor Pritzker passed, with our champions in the state legislature who've done some really fantastic work with Senate Bill 558, which we'll get a chance to talk about as well.
Okay.
But they repealed the Illinois abortion law of 1975, which punished abortion care providers, punishable by you could go to jail for performing an abortion. And this is 75 after it was legal, after Roe v. Wade. And the act also requires that insurance companies, private insurance companies in the state of Illinois, have to, you can't say you can't use those dollars for an abortion, which is so fascinating when we talk about pre-existing conditions, right? Because is having a uterus just a pre-existing condition at that point? How are we deciding what will and what won't be covered under insurance? I'd love to hear your perspective as both someone who works with a lot of employees, what this act means to you. Right.
So if you think about health insurance, it's such an interesting phenomenon that, first of all, so many people in this country don't even have health insurance, right? Or can't afford it, or, struggle to even to have insurance in the first place, right? So as somebody who is over employees, I think it's really important that, one, we provide comprehensive information regarding insurance and, what's covered and what's not, and, have that information accessible to people. But then also, if you think about health insurance, it should be holistic, right? Your health, right? So as a woman, your reproductive health, you didn't have a choice, in being born as a woman, right? So I think that it just makes sense if we are providing health insurance for it to be comprehensive.
Absolutely.
And I don't understand how we pick and choose what is important versus what is not, and what we can, punish and what we can't. And even going back to healthcare providers, it's really interesting to me that they go to school, they're doctors, they learn about these things in school, and then should they come out and try to provide that service to an individual, their freedom could be taken away from them for simply doing the work that they signed up to do.
Providing the very best care possible.
Exactly. I mean, all of this is so incredibly maddening, right? When you really think about it, it just doesn't make any sense. And I just really hope that we get to move forward and kind of make some really good changes.
Absolutely.
And this is one of them.
Absolutely. And I think also from just a medical care perspective, 1 in 3 pregnant people will need abortion care of some sort. And if that statistic were the reality for any other procedure, we wouldn't even be having this conversation. It is healthcare, and it is incredibly safe. So, we've seen, I think, especially over the last 5 years or so, a heightened disinformation campaign from sects of the ultra left, but also the ultra right, and people who are using these various disinformation campaigns to deter people from abortions, to make Planned Parenthood health centers seem like scary places, all of these various smear campaigns to ultimately prevent women from, and pregnant people at large, from choosing their fate and planning their own lives. So I too am excited about this. That was a big win for us in 2020 legislatively. And as we look towards 2021, the REACH Act is a big part of what we're advocating for. So that is the Responsible Education for Adults and Children's Health Act. And it's about us creating a sex education curriculum that recognizes the lived experiences of all of the children in Illinois. So not just the cisgender children, not just the heterosexual children, but the kids who fall K through 12 across this entire spectrum of experiences. And I do believe that, the way that we end up in hospital rooms where Black women are experiencing disparate impacts, disparate impact rates of death and maternal mortality, the reason that Black queer youth are experiencing STI transmissions disproportionately compared to other groups is because we are not realizing them as full human beings. And I think the way to eradicate that is to start it in the K through 12 space, to let children know wherever you fall on the spectrum, your existence is valid. I'd love to hear your perspective as both a policy person, but also as somebody who oversees a lot of students. What are the short-term and long-term impacts do you think will be of the REACH Act, and how do you see that fitting in our educational system?
Yeah, so I think this is really, really, really important. If I can go back to, my value of really fostering education, I think this really, really, really speaks to that, and it starts, when children are young, right? Providing them with all of this information, giving them a safe space to talk about things, and just providing them with all of what they need to go out into the world and, be productive human beings, right? So as a university executive, I think it's really interesting because we see students immediately after they come out of K through 12, right? They step into a space where there might not be parental supervision or there might not be access to somebody to speak to, right? They're kind of a little bit more independent and kind of on their own. And so they are really dealing with making certain decisions. And all of those decisions can be and should be informed based on information that they learn during their K through 12 time, right? So I think just immediately we'll see kids who just have a better understanding, right? And if their friend doesn't understand, they can maybe talk to them, or they feel safe and have that, just safe space where they can communicate and foster that type of environment.
Absolutely.
Long term, though, I think that it will be great as far as the impact that has on other laws, right? So the first thing that came to my mind is Title IX. I work in a space where there are incidents, every single semester. They're not preventable, but we can most likely, and I think what will happen is we'll see a decrease in those cases because people will understand boundaries, people will understand respect, people will understand consent, right? And those are the things that they will learn in K through 12, and they'll just carry that on into their higher education space. And that ultimately helps the university, right? It provides us with a safe space for them.
Absolutely.
They can come and be productive towards the community as well. So I think that this would be really great. I think it would, not only help the individual students, but help the community at large.
Absolutely.
Yeah.
And all of those points are fantastic, and it reminds me of a conversation we had with another Action Council member, Chloe, who talked about her experience in the K through 12 space, and she went to a very small Christian Catholic school in Northwest Indiana, and it was an abstinence-only education. And when she was about 16, she said she went to go get, she tried to go get some contraceptive, an IUD, she said, and went to 2 doctors, said no, nothing. Went to a Planned Parenthood, got it in 30 minutes. And that just speaks to, one, how sexualized Black women often become so young when trying to literally find contraceptive care. You have told this young woman, you can't have this because you shouldn't be engaging in this activity anyway, so you don't need it, even when somebody is showing up in their own body to take care of themselves, how routinely they are turned away. And if we have mechanisms like the REACH Act that exist, of course, that's going, like you said, it's going to impact the other laws. And I think also just the emotional wellness of the students and of our abortion care providers and grown people too, when you are able to see that, acts like this that are seemingly inconsequential can create such a widespread ripple effect on how whole this child is and how confident they feel in themselves. So I too am very excited to see what the long-term impacts of that are.
Definitely.
Speaking of short and long-term impacts, I'd love to talk about COVID for a minute. So Planned Parenthood was very determined to not sort of pause any of our services that we offer. And though we do not directly interface with we interface with COVID patients, but we're not distributors of the vaccination. We believe it is imperative to be a third-party validator for the vaccination because essential workers are on the front lines. Our healthcare centers, our health center employees are on the front lines.
Absolutely.
And it's extremely important that, the people taking the CTA every single day to and from their jobs, the folks keeping this economy afloat, are the first ones to receive the COVID vaccination. I got mine last Friday.
Awesome.
I got an email at 2:00, and by 3:30, I was on my way to the medical institute.
We love America's
shout out to
priorities.
shout out to Pilsen for having them prepared immediately. I'd love to hear your perspective about the vaccination and the vaccination awareness, both as a Black person, and considering our very stressful history with medical science,
Right.
but also as a university executive and what that's going to look like at that scale.
Of course. So I am definitely pro-vaccination. I think it's incredibly important. I'm so glad that we even have a vaccine available, first and foremost. That's something that
Shout out to
amazed me.
the
All of
medical
those
science
scientists,
community.
Oh my goodness. I owe everything to you all. So, but I do think that, I want to spread that same feeling of excitement to my peers, right? And even to my family. I was home for the holidays, and I, heard my dad talking to someone, and he says, I don't really think that we should get it, and they made it too fast, and how did they make that, but they didn't make this? And I had to stop him, and I had to say, hold on. Where did you get your information from?
Yeah.
Right? First and foremost, where did you get your information from? And he's like, I just don't trust it. I just don't feel it. I saw a YouTube video. And I said, okay.
There it is. You were like, way to go, one of the
Right.
buzzwords.
I said, okay, who was the YouTube video from? Some guy, right? So it's a lot of, one, just genuine and inherent distrust, right? Which we can understand from Black people in this country, considering our long history, right, with medical providers in this country. But I also think it's interesting because my dad is an American. My dad came here from Jamaica. And that same distrust carried through. He's only been here for about 25 years. So it's not his, entire life, but he can even see in the media and in the community kind of understanding that Black people here really do have trouble with trusting healthcare providers, trusting, vaccines in general, kind of having access to that information. I think the first thing is having access to information, right? Having someone to talk to about, even if they want to get down to the science, maybe I can just spend 10 minutes with you and explain, this is how the vaccine was made. I'm not a scientist, but I do have a general understanding of, how they put it together and how did it come by so quickly. And then also helping people understand that there is a repercussion to not getting vaccinated, right? And if you want to weigh the risks between the two, let's do that. Let's think about things and kind of have a healthy conversation around vaccinations.
Absolutely.
And maybe that will kind of instill a bit of trust. And I do think also seeing other people being comfortable getting the vaccination helps the community as well.
Absolutely.
Right? As far as being in the university space, we have students living on campus, right? So we have dorms. If you think about anything in dorms, 18-year-olds.
Like, oh God, literally anything that's happening in
nicest space
from
all
the moment
time,
we
right?
get up in the morning to the moment we go to sleep, it's disgusting.
You're with someone, you're in someone's face, you're sleeping next to someone, right? It's crowded, it's community, it's togetherness, right? So we obviously want to have our students safe because they're on campus,
of course,
and being in the classroom is fun, and that's part of being in college. You want to be around people, so we definitely are looking forward to having our students vaccinated, and then also, of course, our employees, because they have to come to work, right? They don't have a choice, right? So we want to make sure that when they come here that they're safe and they feel good about where they are and they're not worrying about whether they're going to get COVID or not. So I think having access to the vaccination would be amazing for us, and hopefully looking forward to getting that soon so we can get back on campus.
Yes,
yeah,
absolutely.
Yeah. So, well, I actually used Planned Parenthood when I moved to Illinois.
Boom.
So I am from Florida,
okay,
and I moved to Illinois in 2015 for law school. And when I came here, my health insurance actually didn't cover me for doctors in Illinois. And so I had to go to Planned Parenthood for my reproductive care. And that's kind of when I got my first introduction to Planned Parenthood and what they are and what they stand for. And I was in Planned Parenthood for my regular checkups, STI screenings, all of that for about 4 years before I got a primary care doctor in the city. And so I use Planned Parenthood, right? So I definitely can even account for how helpful they have been and how integral they have been to my own healthcare. So
absolutely.
Yeah.
And that makes me really, really happy, because that's just another example of why programs like the Black Organizing Program are so critical to the understanding of Planned Parenthood, because the fight for sexual and reproductive health care has become a fight it's so politicized. There are a lot of folks and there are a lot of forces in this country that want people to believe that Black folks don't require access to Planned Parenthood, that we don't go there, and that simply isn't the case. I too, the very first STI screening, cancer screening, all of those things that I had were at the Planned Parenthood down the street from my home. So having having programs like this that sort of bridge that gap, that show, no, there are plenty of Black people who actually require the Planned Parenthoods in their neighborhoods to provide their basic, we're not even talking about abortion care, we're talking about STI screenings, cancer screenings, where can you go pick up some condoms, where you can go get a dental dam, like all of the things that people who are fully like sexual beings need throughout their lives to make healthy choices. So I'm very glad to be working with such a dynamic group of grass tops, private sector, and organizers who are all helping us advance comprehensive sexual and reproductive health care. It's so exciting. And I get to work with like really, really dynamic Black people. We love it. During this work. We love to see it. We do. So thank you so much, Latoya. I really appreciate this and can't wait to do all this work together.
Yeah.
Sweet.
Looking forward to it.